If you are there in India, you will realize that the challenge has been that how can we create one ecosystem over here. There is a lot of division, not just in terms of religion, but also in terms of castes, and within castes. On one side, while you have a really vibrant and rich India, there are areas, even if you take an hour's drive away from this place in Park Street, there is no clean drinking water, there is no basic amenities. In a country of 1.2 billion people, the areas which really need a lot of investment is education and healthcare. This was an organization which was meant for the poor and the needy. It's made a big impact where people who under normal conditions could not afford taking care of their health are being treated. The entire healthcare system that we are operating in includes a hospital, community centers in Calcutta, clinics across the state of West Bengal, a school of nursing, and a vibrant outpatient department. Through all of this, we treat about 40% of our patients free of cost. If we look at the founding days when the late Mark Buntain and his wife Halda Buntain actually started the work over here, this used to be a very poor neighborhood.
We started with a clinic at the back of our first church at Royd Street. A little girl fainted in our school. Mark said to her, "When did you eat last?" She said, "I can't remember." He rushed her to a city hospital. And when he saw the treatment that poor child got, he came back with tears in his eyes and said, "I'm going to start a clinic for these children." The clinic got too small. Mother Teresa was after Mark to build a full general hospital. So in 1977, we built a full hospital right in the center of Calcutta on the main street. And since then, we have been able to treat thousands and thousands that were so sick.
Today, we are a city-based hospital. It's a dynamic organization where we are able to reach out to different strata of society. I think if the vision is carried on, it's a baton which is being passed from one generation to the other. We as Indians, we need to actually stand up and make the work which has been started more sustainable. You have to have a product, a service, a facility which is transparent, which is responsible, which is sustainable. There is a social value which is being imparted. Your $1 should be having an impact that if it was seeded 30 years ago, what has that $1 contributed today? Because you're not just reaching out to one person, you're actually changing a generation for the future. That's your social impact.